Care of aging skin. Age related to changes to skin, hair, and nails. We know that as we get older, our skin is going to undergo several changes. That epidermal layer will become thinner and subcutaneous tissue will diminish, so it increases the risk for traumatic injuries. Medication can also make skin more fragile. We have a decreased sebaceous secretions and circulatory changes that will lead to dry skin. And due to changes in the function of those dermal receptor cells, the older adult will lose the ability to even perceive some sensations. Skin issues can lead to a decreased quality of life. And the healthcare team should attempt to prevent problems or recognize, treat, and resolve those skin issues promptly. Changes in the skin, hair, and nails can indicate a variety of problems related to nutritional and circulatory adequacy. Assessment should be important to the nurse. With the hair, the color. We lose pigment and our hair will become gray and white as we get older. It's also going to become thinner and/or is lost. And we have decreased hair in the axilla, extremities, and the pubic area, while we have increased facial hair in women, longer and bushier hair in the eyebrows, nares, and ears. Our nails are going to grow slower and become thinner or even thicker and become brittle, and they might also be discolored. As far as our skin itself, it will appear thinner and more translucent, paler, will have large pigmented spots, more frequent bruising, and dry skin. We have the decreased sensation and that change in skin color. Always examine skin in good natural light and compare the two sides of the body. Use touch to determine temperature or presence of rashes or irritation. Color changes in the skin can indicate a variety of problems, and this needs to be recorded and reported. Dry skin is one of the most common problems of aging, and it can result in itching or pruritus, burning, and cracking of the skin. And scratching or picking at dry, cracked skin can increase the risk for further tissue damage and infection. Irritation can be severe and lead to intense discomfort. So we as nurses recommend bathing less frequently and with warm, not hot water, using moisturizing soaps and lotions, staying well hydrated, and also using humidifiers. Rashes and irritation can be caused by medications, communicable diseases, or contact with chemical substances. Diffuse rashes over the body can indicate allergic reactions to medications, for example. Older adults are particularly susceptible to scabies, especially if that adult has chronic illnesses, dementia, or a depressed immune system. The first period, the first 4 to 6 weeks, we consider to be asymptomatic, as this is the incubation period. And then the client will develop intense itching with fine, dark, waving lines. This is spread by direct contact. Changes in skin pigmentation are also common with aging. Common conditions such as acne rosacea can be treated with topical medications. Other conditions can be concealed by clothing or cosmetics. Changes in the size or pigmentation of moles would be of greater significance because they can indicate the presence of maybe a precancerous or cancerous condition. Breaks in tissue integrity will increase the risk for infection and often result in the need for costly, time-consuming treatments. Skin tears, abrasions, lacerations, and ulcers most often result from friction, shearing force, moisture, and pressure. Minor incidents can cause significant skin trauma. Older adults are at a particular risk for pressure injuries if they have compromised circulation, restricted mobility, altered level of consciousness, fecal or urinary incontinence, or nutritional problems, and it has an overall negative effect on their health. It can lead to infection, pain, loss of function, death. They are categorized or staged based on the appearance and depth of the tissue penetration. A formal risk assessment is recommended at the time an older adult is admitted, when they're discharged, anytime they have a change in their condition, at regular intervals. There are a couple of scales for assessment, including the Braden scale and the Norton scale. The amount, distribution, appearance, and consistency of hair. Once again, it typically becomes thinner and has a finer consistency with advanced age. Men tend to lose more hair than do women, although some men will retain a full head of hair all their life. Male pattern baldness typically will result in progressive loss of hair at the temples and the back of the head. Alopecia is a sudden or excessive loss of hair that usually indicates a systemic problem, and it should be investigated. Diminished hair on the extremities might indicate reduced circulation. Thinner hair in the axilla, pubis, and extremities are noted as we get older. And once again, increased facial hair growth in women, bushy eyebrows, longer nasal and ear hair are also noted in all older adults. Many aging individuals are unable to bend adequately to view their feet. A family member or friend can inspect feet for independent older adults, and many older adults will neglect their feet because they cannot see them or reach them. But unless a foot inspection is done on a regular schedule, severe problems can occur before anyone is aware of them. With nails, aging will result in hyperkeratoses of the nails, particularly the toenails. So they get really thick and hard, and it makes them difficult to cut using normal foot care equipment. The strength and effort required to cut these nails may even exceed an older person's abilities, and this will result in overgrowth. In cases of diabetes or impaired circulation care, these clients need to be seen by a foot specialist. Nail fungus is common in the older adult with diabetes or decreased peripheral circulation. Other common foot problems will include corns, calluses, blisters, and bunions that usually will result from years of poorly fitted footwear. This can cause discomfort and lead to activity restriction. So risk factors for alterations in skin, hair, or nails in the older adult include, once again, circulatory problems, restricted mobility, nutritional or fluid imbalances, cognitive impairments, exposure to irritating chemicals, including body secretions or waste products, exposure to communicable diseases, and lack of adequate hygiene facilities or assistance in the home. So the goals for these clients would include remaining free from excessive skin dryness or skin breakdown, display timely healing of wounds, lesions, and ulcerations, and maintain optimal nutritional status to promote tissue integrity and healing. Interventions include assessing the level of alteration and the contributing factors, instituting measures to reduce the risk for skin and tissue breakdown, instituting measures to promote healing, and providing thorough foot care. Question: A superficial infection caused by a parasitic mite that burrows under the skin is, and this is scabies. Age-related changes in oral mucous membranes can be a major problem in older adults if they have poor oral hygiene. They just fail to see oral care as a priority, or maybe the cost of oral care is prohibitive. They may have restricted access to dental care or physical or cognitive limitations. And even nurses place oral care at a lower priority. So it is necessary to determine the quality of a person's oral care. Inspect the oral cavity. Dental caries are ongoing problems. We see tooth decay, loose teeth, and lost teeth because of caries. It can lead to poor nutrition, decreased appetite, decay or caries is caused by the action of bacteria that penetrates through the enamel shield of the tooth and will cause destruction. Periodontal disease is a less obvious but potentially more serious complication of poor oral care from accumulation of food and plaque. Gingivitis is inflammation of the gums, and it can eventually lead to halitosis, which is bad breath, loss of teeth, difficulty chewing, and bacterial infections. Periodontal disease is linked to thromboembolic disorders, bacterial endocarditis, and myocardial infarction. Pain in the mouth can be caused by dental caries, periodontal disease, stomatitis, and other lesions. It may be limited just to the oral cavity, but it can also affect the face and the jaw. This will cause loss of appetite, decreased food intake, and a negative effect on the overall quality of life. Dentures. Some clients may just start with a partial plate or a bridge. Partial plates can be problematic because they tend to catch particles of food and then can weaken healthy teeth. Complete dentures are expensive and they can be difficult to fit. They may not fit properly if a significant amount of weight has been gained or lost. They can cause irritation, inflammation, and ulceration of gums and oral mucous membranes. Even if a client feels their dentures are fitting right, if they're having irritation, inflammation, ulcers, they should see their dentist because it just may require a minor change or adjustment. Dry mouth, also known as xerostomia, can result from normal age-related reduction in saliva secretion, inadequate hydration, and disease conditions such as diabetes. It can make chewing and swallowing more difficult. It also promotes tooth decay and alters the sense of taste. Leukoplakia are white patches we see in the mouth, and often these may be precancerous. They require prompt medical attention. Lesions on the posterior third or sides of the tongue are often abnormal and also should be brought to the attention of the healthcare provider. Oral and pharyngeal cancer frequently have poor prognoses because they're often discovered late. So early recognition and treatment will offer the best outcomes. Symptoms will include lesions that don't heal within 2 weeks, a lump or a thickening in the tissue, red or white patches in the mouth, a sore throat or sensation of something being caught in the throat, difficulty chewing or swallowing, difficulty moving the tongue or the jaw, numbness, swelling of the jaw, improperly fitting dentures, and chronic hoarseness. Alcohol and tobacco, even in small amounts, can harm the mucous membranes in the mouth. Alcohol is chemically irritating and drying to the mucous membranes. And tobacco, whether it's smoked, chewed, or taken as snuff, increases the risk for oral cancer. Neurologic conditions also will decrease the coordination and strength of a client, making it difficult for them to manipulate the equipment needed for oral hygiene. Severe arthritis can also make it difficult to open the mouth. And medications for epilepsy and other seizure disorders can cause hyperplasia of the gingiva. So nursing goals, outcomes, identification for altered oral mucous membranes. This involves obtaining regular professional dental care, demonstrating techniques for maintaining or restoring the integrity of the mucous membranes, inspecting the oral cavity regularly and seeking care promptly if symptoms occur, experiencing no unusual signs or symptoms, ingesting foods and fluids without discomfort, and verbalizing specific actions to promote healthy oral mucous membranes. We do this through completion of a thorough assessment of the oral mucous membranes, initiating a referral to a dentist or dental hygienist, providing oral hygiene, promoting adequate intake of nutrients and fluids, providing lozenges or topical analgesics as prescribed, and communicating suspected oral side effects of medication therapy to the primary care provider and the dentist. A hairy tongue is the result of enlargement of the papilla on the tongue, and this also or often will follow. The correct answer is A, antibiotic therapy.